It is generally accepted that chemical dependency, along with associated mental health disorders, has become one of the most severe health and social problems facing the United States.
Drug addiction is very complex. Many people don't understand addiction or why some individuals become addicted to drugs. They often view drug use and addiction as a social problem, and those who use drugs as having low moral character or weak character. They believe that individuals make a choice to use. It's a willing act, indeed a poor choice, and therefore should be able to stop using simply by making a choice to change their behavior. It's just not that simple. Addiction is a chronic, debilitating, often relapsing disease. It's defined by signs of tolerance, withdrawal, and compulsive or what we call out-of-control use. Although an individual may make an initial decision to use drugs, over time, repeated use causes significant changes in the functioning of the brain. And these changes affect the person's self-regulation or control, and they send strong impulses to seek and use drugs. These impulses are often irresistible. This is very complex and hard for people to understand. Through research, advances in brain imaging techniques, and accumulated experience and wisdom, we know much more about how drugs impact or work on the brain. We also know that drug addiction can be successfully treated, oftentimes with a combination of medication and psychological treatments. Most people have heard of the chemical dopamine. Dopamine is a chemical that naturally occurs in the body. Dopamine activates a natural reward system in the brain that produces the sensation of pleasure. Dopamine rewards certain behaviors, and this system plays a critical role in basic adaptation and survival. Drugs activate the same system, but they do so much, much stronger and longer lasting. Drugs flood the brain with dopamine. With repeated drug use, the dopamine reward system becomes significantly changed, where now the brain requires an increased level. This is called tolerance. Now the brain requires more drugs to feel the same high or pleasure, and without drugs, the person is in a state of deprivation. The brain does not activate even normal levels of dopamine. Dopamine deprived, the person can't feel much pleasure, they lack interest in things, there's no excitement, they feel anxious, depressed. Now the person experiences very strong impulses to seek and use drugs. The drug makes them think about using, and it takes over the body. They feel and become desperate. This is the origin of compulsive use. They use despite severe consequences, sometimes catastrophic consequences. Loss of marriage or job, maybe custody of their children, decreased health, recurrent legal problems, and more.